I know that POTS is not a rare disease, but I do think that the promise of AI and what it can do for neuroimmune conditions like POTS is very similar to what AI might eventually be able to do for the rare disease community as well. And I just wonder if you can give us an update for what you see as the promise for AI in healthcare.
Of course. So, first to take a step back and think about the pretty atrocious stats. 3 out of 5 Americans believe the healthcare system is broken. 9 out of 10 people do not understand their health information. Half of our physicians have at least one symptom of burnout, and the average appointment time in the US is about 18 minutes. So when you look at all of that and you realize the complexity of health, the fact that this is the most important part of your life, and you're being treated by people who fundamentally, structurally cannot have all the information, that are seeing you for 18 minutes and do not have the tools to connect all the dots, and are giving you information that 9 out of 10 people do not understand, that's a pretty sad state of affairs. So it looks like we can only do better from there. When you look at what AI can do, in my mind, it's a couple of things. One is massively increasing access. 40 million people every day ask a health question in ChatGPT. 7 out of 10 of these questions are after hours. And so it really shows you that we can really fulfill the promise of having a doctor in your pocket. Access also means access to funding, because we have a lot of people who use ChatGPT to work with their insurance companies to get drugs reimbursed. We had a patient, Rich Kaplan, who put together, thanks to ChatGPT, a real case for why these very specific drugs that wasn't usually approved was perfect for his own condition, and actually got approval. So access is, I think, going to be a very big theme. The second theme is defragmentation. Again, like when you look at how the system works, a lot of diseases require looking at the full picture, and the healthcare system is not set up to do that. So with ChatGPT Health, you now can connect to your health records, and you're able to look at your entire health history, all of the factors that impact your health, and put your health decision in the context of everything about you. That's what doctors don't have the luxury of doing with an 18-minute appointment. And then finally, I think, as we all know, healthcare is still very much sick care. It's not preventative, it's not proactive. Here, you have, like, because of the level of access with AI, you're going to have a physician in your pocket who is able to tell you every morning, hey, this is how you slept based on your wiring, this is what you should be doing today, this is how you should be eating differently. And that's a completely different ball game when you know that about 87% of healthcare costs is linked to lifestyle-related diseases. So I think there's a tremendous opportunity to really rethink how patients engage with the healthcare system and really level the playing fields between patients and doctors.
I mean, you've had the experience yourself of using ChatGPT Health to help you when you were, I think, in the emergency room. Maybe it was in the hospital?
Yeah, I was hospitalized for, I just had surgery for a kidney stone, and the resident came in, told me, you have an infection, we need to give you an antibiotic. And I was like, hey, wait 5 seconds. I just want to put that into ChatGPT. And I had already connected all of my health records with ChatGPT. And ChatGPT told me, hey, this antibiotic would actually be very bad for you because 5 years ago, you had this particular infection, and this antibiotic is known to reactivate those kinds of infections. So I was able to tell the resident, and she was like, oh my God, thank God you caught that. That could have been really bad. But none of our systems allow us, when we're making rounds and spending 2 minutes per patient, to see an infection that they had 5 years ago. And so she was able to change the antibiotic. But that tells you there is such a dearth of relevant information on the patient in the system that prevents clinicians from always making the right decision. And I think AI can help both patients and clinicians.
Is it HIPAA compliant? Are you going to be doing any research using the information, my most personal information that I'm putting into ChatGPT?
So the answer to the second question is clearly no. We actually launched ChatGPT Health with, some terms that prevent us from training on that health data and additional privacy protections. On your first question on HIPAA compliance, HIPAA compliance applies to the relationship between a doctor and a patient, and therefore it actually doesn't apply to ChatGPT. So even if we wanted to be HIPAA compliant, we couldn't because the legislation doesn't apply to us. However, the products that we give to physicians is HIPAA compliant. So they can use ChatGPT for physicians inside the hospital systems, and that's HIPAA compliant.
Fidji, it feels like we are on the cusp of some really great innovations. We've had people on stage already today talk about how AI is speeding things forward. What's holding us back at this point?
I think there's a couple of things. One is, first up, there's a lot of reasons to have hope. And I want to emphasize that because I am seeing, the power of the models massively increase. Like it used to be every 6 months, now it's every couple of weeks. And so I really want to instill a lot of hope in this room that we finally have an exponential technology that can really break through a lot of the roadblocks that have held us back. But I think there's still a couple of things to do before realizing this magical promise of AI curing all diseases. One is we're still missing data. If you think about AI, it was able to be so performant on language because the internet already existed, so we could train on massive amounts of language. The same doesn't exist for biological data, and that's what I'm building with ChronicleBio, as you know. Yeah. I think we really need to have great, rich databases of biological multi-omic data so that these models can be deployed on that biological information and help us understand biology a lot better. That's step number one. And then even when you accelerate, target discovery, drug discovery, etc., there's still a very big, regulatory roadblock. But I also think that AI is going to be able to accelerate that. I think AI is making any administrative task faster, so it should make the regulatory process faster. And I also think that AI is going to be able to model out safety outcomes without having to do, all of the current clinical trial infrastructure that we have to do. So I have a lot of hope that it will accelerate things, but I don't think we should expect that, AI on its own just magically discovers things. I think we have to make sure that we build an ecosystem around these AI models that facilitate discovery and accelerate the path to cures.